I've seen this question many times in the comments. Doc, I have many of these symptoms that you described, but how do I know when I should see someone about it? That's what I'm going to answer today. I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. Whether or not you see a doctor is based on how much of a problem the symptoms cause you. You can walk around with mild depression symptoms that don't cause a lot of problems and then go away in a few days. Also, what's a problem for one person may not be as much of a problem for the next person. So there's not one answer to this, but here's my opinion about what you should consider when determining if your symptoms are bad enough that you should seek treatment. You can look at 4 things: the number of symptoms that you have, the intensity of your symptoms, the frequency of your symptoms, and how much the symptoms are causing problems for you. So let's take a look at the first one, the number of symptoms you have. The Diagnostic and Statistical Manual of Mental Disorders has a list of symptom criteria for every disorder. And usually to qualify for the diagnosis, you need a certain number of symptoms, like 5 out of 8 for depression. But you don't need to memorize the 8 symptoms that match depression so that you can know if you have it. Just think about the things that are not normal for you. Like maybe you feel sad all the time. Maybe you feel hopeless and not motivated to do anything. Or maybe you have trouble sleeping. So let's start with those 4: sadness, hopelessness, low motivation, and sleep problems. The next thing is to look at how intense are these symptoms. Do you have a day when you're in a funk and you want to cry all day? Fighting back tears or wanting to cry is more intense than just feeling sad without crying. Next, let's look at the frequency. Let's say you have an off day and you find yourself having a couple of crying spells. Then, after crying, you feel better, and the next day it's over. That one day of crying may not be a reason to see a doctor, but if you keep waking up fighting back tears on most days and more weeks of the month than not, then something is off, especially if there's not a situation that could have triggered your sadness. Then you want to look at how your symptoms affect your functioning and ability to move through your life in the usual way. Are the sleeping troubles and low motivation getting in the way of finishing projects or meeting responsibilities? Maybe it's not, and it's just a minor nuisance for you. Or let's say you feel like you're going through a rough patch where things aren't flowing for you, but then you get back on track by talking to a friend, reading a self-help book, or watching a helpful YouTube video. In these cases, you don't need professional help. Whether or not you seek professional help is still a personal decision, but another way of looking at this question is, are the problems you're having likely to go away on their own, or will they get worse until you get help? That's a different perspective on this question. You may be going through a tough time that allows you to keep things moving and it's only temporary. But how do you know if your symptoms are an early warning of something that will inevitably get worse? Here are some symptoms that are not part of the ordinary ups and downs of life and are likely to worsen without professional help. In the depression realm, a more serious symptom is feeling suicidal. If you find yourself thinking that people would be better off without you, or that you'd just rather not be around because you can't stand the pain, you should seek professional help immediately. If you don't have quick access to a psychiatrist, you can see your primary care doctor. If you have a formed plan that you're waiting to act on, you should go to the hospital for stabilization. Another symptom that usually only gets worse is delusional thoughts. Some people can have a fleeting bout of paranoid thinking that's transient, which means that it comes and it goes. But often this kind of fleeting paranoia doesn't rise to the level of being fully delusional. If the person is challenged on it, they may back down and say, yeah, I don't really believe my neighbors are trying to spy on me, but I just don't trust them. They make me uncomfortable. But fully formed, irrational, delusional beliefs are not normal. Even if they go away for a little while, there's still a good chance they'll come back. You should seek a professional to help you see or figure out why you're having these thoughts. Delusions that happen inside of a manic or depressive episode are usually a measure of the intensity of those conditions. Severe depression can lead to delusional beliefs, as can an intensely manic experience. So in those cases, you're having other symptoms that go along with the delusions, and if you ignore all of the symptoms, they can continue to intensify, like a hurricane moving over warm water. Anxiety signs that I think are not likely to resolve without professional help are severe compulsions and rituals that are getting in the way of your functioning. An example of this is taking 2 hours to drive to the store because you keep stopping to make sure that you didn't run over someone with your car. Other anxiety signs that usually worsen without help are frequent and intense panic attacks and lots of avoidance associated with a phobia. An example of this kind of avoidance is, say, you start with avoiding crowded places because people make you anxious, but then this progresses to not leaving your home, even for important things. Avoidance is a big part of anxiety, and it makes whatever you fear grow into a bigger problem. The last symptom I'll mention that needs professional attention is other psychotic symptoms like hallucinations. I already mentioned delusions, which are a psychotic symptom, but hallucinations and very disorganized speech or thoughts should be evaluated by a professional. Drugs like psychedelics, alcohol intoxication, and marijuana can all cause these symptoms, and if that's why you're having the psychotic symptoms, they usually go away once you stop the substance. But if you have these symptoms all by themselves, it's usually a sign of some other kind of psychiatric or even medical disorder that should be evaluated. When would you see a therapist instead of a doctor? You would see a therapist for problems related to changing your behavior or improving relationships or working out trauma experiences. Examples of behaviors that a therapist could help you with are compulsions and avoidance from phobias like social anxiety or spiders. Medication may help the anxiety or depression that these behaviors cause, but therapy is really what you need to change your mindset and actions. The same with a trauma reaction. Medication may help you sleep or ruminate less, but working through and processing the traumatic experience is a separate process. Can a person live with traumatic memories without needing to see a doctor or therapist? Yes, many people do, especially if they were mildly affected by the trauma. What would that look like? You may be reminded of a difficult childhood, and that memory causes you distress, but the distress is momentary. It doesn't keep you from working or having relationships. It may affect your self-concept, but you still have enough esteem that you can pursue goals and have positive expectations for yourself. Take a look at this video where I talk about how trauma can affect the way you remember things, and this one on recognizing the difference between having depression and feeling depressed. Thanks for watching. See you next time.